Good afternoon, ladies and gentlemen. My name is Luca Hergár, and I would like to present you my 3 months progress on my topic, translational key points between radiology, physical examination, and hand surgery. I'm a resident doctor at the orthopedic clinic. I would like to be a hand surgeon, and I think we can all agree that it's very important for doctors and patients as well to get a correct diagnosis as soon as possible. This is why my vision is for every patient to get an adequate diagnosis at the first doctor-patient interaction. Of course, there are many roadblocks on this way, but I hope that if I accomplish my mission to evaluate the diagnostic accuracy of MRI imaging for the wrist and the clinical applicability of two-point discrimination, we might get one step closer to this vision. I'm currently working on 4 projects, and I would like to present you these projects in the following minutes. My first project is investigating the diagnostic accuracy of magnetic resonance imaging for lesions around the wrist. Why do we consider this research important? It's because wrist soft tissue injuries are common pathologies. This can be in the background of nearly 1/4 of chronic wrist pain. Currently, the gold standard diagnostic procedure is arthroscopy for this disease, but this is an invasive, time-consuming, and expensive method. Before the arthroscopy, we can use MRI imaging as well, but the diagnostic accuracy of this method is spread on a large scale in the literature, from 60 to almost 100%. This is why the aim of our study is to evaluate the diagnostic accuracy of magnetic resonance imaging for wrist cartilaginous and ligamentous lesions, and also to determine what are the factors that are affecting the sensitivity and specificity of this method. We would like to investigate patients with suspected cartilaginous or ligamentous lesions of the wrist and compare the sensitivity and specificity of wrist MRI to arthroscopy. If it avers that wrist MRI has a reliable sensitivity and specificity, this would mean that we could reduce the number of purely diagnostic arthroscopies, achieve better cooperation with the patients, save time and expenses. This is why we would also like to examine the factors, what might have an effect on the sensitivity and specificity, because we believe that if we could apply these factors in the everyday clinical care, we could increase the sensitivity and specificity. We have conducted the systematic research in October. We found a bit more than 4,000 articles, and out of this pool, we selected 44 as eligible full text, and currently we are working on the data extraction. With the second project, we would like to investigate the effects of different conditions on two-point discrimination values. Two-point discrimination is an easily applicable, reproducible clinical method to investigate the sensory function of the hand. In the literature, the normal value of two-point discrimination is between 5 and 6, according to different authors. And in this research, we would like to examine what are the factors that might have an effect on these normal values. We would like to examine conditions such as age, gender, pregnancy, cortical function, BMI, and laterality. These are conditions that don't have a direct effect on the sensory nerve function. They don't cause sensory nerve function impairment, but still could have an effect on the two-point discrimination. And why is it important to know these factors? It's because for a hand surgeon, it's important to be able to evaluate the sensory function of the hand. And if we have patients with different conditions, for example, elderly patients or pregnant patients, it's important for us to know what are the values we should expect from these patients. With this project, we are almost finished with the Prospero registration, and we hope to proceed very soon with it. Our third project is registry analysis. We conducted this research earlier. The title is Correlation between two-point discrimination and electroneurography in carpal tunnel syndrome. In carpal tunnel syndrome, the patients have a motor and sensory loss of function, and it's important to be able to evaluate the severity of this disease, because based on the severity, we can choose the adequate therapy, and also we can use it for follow-up for the patients. Currently, the gold standard is electromyography and electroneurography to evaluate the severity, but in the clinical during the physical examination, we can also use two-point discrimination measurement for the sensory function. And the aim of our study was to define whether there is a correlation between the two PD values and the electroneurographic results. Here you can see the different categories in the ENG categories and the two PD discrimination values what we used in this study. We consider this research important because if we could state that there is a correlation between the two PD values and the electroneurography results, it would mean that based on the two PD values, we could estimate the result of the ENG studies, and therefore we could start planning the operation sometimes weeks before the actual results, and this way we could facilitate the diagnostic and therapeutic procedures for the patients. Here you can see our results. We found significant results in two categories. There was a correlation, the distal sensory latency and the severity categories, but the correlation is not very strong between these values. So we can't conclude yet if it's a really useful clinical method in the evaluation of severity of carpal tunnel syndrome, but we would really like to continue this research. We consider this research as a pilot research, and our actual aim is to continue and create an international survey after we evaluated the strengths and limitations of this third project. And here you can see an overview about the ongoing project. We would like to finish with the meta-analyses in the beginning of next summer, and we would like to continue with the two other registry analyses as well. And I would like to thank you for your attention with this inspirational quote from Antoine de Saint-Exupéry. A goal without a plan is just a wish. If you have questions, I will be happy to answer it.
Congratulations. I'd like to ask you about, well, concerning the first project. Since you're looking at soft tissue lesions, wouldn't it be possible to include an ultrasound as well?
Yes, thank you for your questions. These are very small structures, and the visibility at ultrasound is not reliable enough. So this is why MRI imaging is advised in these pathologies.
I have a question regarding, I think that's your second project with the first two-point discrimination project, when you are investigating certain risk factors which can influence actually the measurement results. So that's what you are looking at, yes?
Yes.
What is your hypothesis? So you are expecting to be there difference, or you are expecting that there are no differences?
I expect that there will be a difference. We have conducted the pre-search, and we found several articles that they mentioned that the age can be a risk factor. With the age, it's expected that the two PD values are longer. It means worse, but there was no previous meta-analysis in this topic.
I'm just wondering if this is good for us. I mean, if we are having a diagnostic method, then we are expecting that that method is usable with every kind of patient. Or I don't know if I'm wrong.
You mean that it takes away from the diagnostic value of this test?
Yes. Do you think that?
It might be, but I think it's important to know that, for example, if we found a 2PD value, what we would consider that there is a sensory function impairment. But if we know that this is an elderly patient, the results are not that bad, but still above the limit. But if we have the knowledge, if we can say that this is because of the age, what is a normal thing that the 2PD function with age will decline, then we won't worry if there are not no significant symptoms, then we won't say that, oh, this person must be operated soon, because we know that this is a normal variation of this of their condition.
Can we see the results of your third study, which was actually really the first one?
This one?
Yeah.
Yes.
I mean, this is interesting because, I mean, I not fully understand, I have to say. But, I mean, I have two questions. Question one, since you started this 4 years ago or so, and now you just completed, and then the results are, I mean, maybe promising, as you said, but then might be some things to be modified. Did you learn anything in the meta-analysis course or this kind of translational medicine course that actually you can utilize to make it better? This is question one.
Yes, definitely. And I started this research when I was a third-year medical student. And now, for example, when I looked at my data table, I realized that I made technical mistakes, but I hope I won't make any more. So to answer your question, yes, definitely. During these lessons, what we learned in the past weeks, I think we advanced a lot in the methodology of our research. So this is why also we consider this study as a pilot. So now we can face the mistakes we made earlier, and when we design the bigger study, for example, the multi-center study, then we can avoid these mistakes.
So I think this is a very important message for all of us, I would say. I mean, not only for yourself. But
yeah.
The other thing, which is, I'm not quite understood. So there are two different methods when you do the measurement. And so there is no correlation between the... I didn't understand where there is no correlation between the two type of measurements or between the severity and the newly suggested measurements. Because maybe the old stuff is also kind of unreliable, I would say. I mean,
you mean that...
many times that happens, that you want to measure something and then you realize that actually the methodology is not absolutely perfect for the thing what you want to measure.
Yes, it can definitely be the case. For example, what is currently the gold standard, the ENG and the EMG, the severity grade is given based on the motor and the sensory function. And with the 2-point discrimination, we only measure the sensory function. So there might be a discrepancy with this as well, that maybe we don't exactly measure the same function. And but if that's the case, then we could say with certainty that unfortunately the 2-point discrimination is not good to use during the physical examination to evaluate the severity. We can still use it to evaluate the sensory function, but maybe not for the severity. But as there is a severity grading of this 2-point discrimination as well, this is why it occurred to us that it could facilitate the whole therapeutic process if it would be useful for this diagnosis as well.